How is stage 1 lymphoma treated? Imagine your body's lymphatic system as a network of highways that help fight infections. When lymphoma occurs at stage 2, it means the cancer has spread to 2 or more lymph node areas on the same side of the diaphragm or has limited spread to nearby tissues. Treatment choices depend on whether it is Hodgkin or non-Hodgkin lymphoma, along with specific features like symptoms and risk factors. For stage 2 Hodgkin lymphoma, doctors often recommend a combination of chemotherapy and radiation therapy. Chemotherapy uses drugs to target cancer cells throughout the body. A common regimen is called ABVD, which includes 4 to 6 cycles of medications like doxorubicin, bleomycin, vinblastine, and dacarbazine. After completing chemotherapy, doctors use PET or CORT scans to see how well the treatment worked. If the scans show the lymphoma has responded, radiation therapy is usually given to the initial sites of disease. This involves targeted radiation to shrink or eliminate remaining cancer cells, especially if the tumor was large or if symptoms like fever or night sweats were present. If the lymphoma does not respond well or comes back, more intensive treatments like high-dose chemotherapy followed by stem cell transplants may be considered. Newer treatments, including immunotherapy drugs such as brentuximab vedotin or PD-1 inhibitors like nivolumab and pembrolizumab, are also options in certain cases. When it comes to non-Hodgkin lymphoma at stage 2, treatment depends heavily on the specific type and how aggressive it is. Some slow-growing or indolent lymphomas might be watched closely without immediate treatment if the person has no symptoms. When treatment is needed, options include chemotherapy, immunotherapy with drugs like rituximab that target specific proteins on cancer cells, targeted therapies, and sometimes radiation therapy for localized or bulky tumors. For cases where the disease returns or does not respond to initial therapy, stem cell transplants or newer cellular therapies like CAR T-cell therapy may be used. Radiation can also be helpful for controlling localized disease or large tumors. No matter the type, treatment plans are tailored to each individual. Factors like the lymphoma subtype, overall health, symptoms, and how the disease responds to initial therapy all influence the approach. Regular imaging and clinical evaluations help doctors adjust treatment as needed. It is essential to work closely with hematology and oncology specialists who follow the latest evidence-based guidelines to determine the best course of action. Remember, every person's journey with lymphoma is unique, and personalized care is key to managing the disease effectively. Always consult healthcare professionals for advice tailored to your specific situation.